When we started working with Quamtaro ADP, there were some very, very serious health issues. Infant mortality was extremely high. You know, almost 1 in 5 children did not get to see their first birthday. And that's a huge loss for the community. Malaria was the biggest killer, followed by diseases related to poor water, like gastroenteritic type conditions, parasites, worms, severe diarrhea, and you know, all these things lead to very low nutrition, which means it's very, very hard for the children to develop. Women's health was quite poor. Women would have, for instance, when they're pregnant, high levels of anemia. There's a high rate of women dying in childbirth. So we were very, very concerned about that. The level of vaccination was quite low, obviously, and then you're talking about preventable diseases, so people don't really unnecessarily all the time. So what the project tried to do right from the start was to try and find a lasting solution to the health issues. Obviously, it's important that we support clinics and deal with curing illnesses, but the most important thing is to try and prevent illness and try and find a way in which the community can manage local illness. So what that often involves is training local village level health workers in areas that don't have easy access to a clinic. Quamtaro ADP has seen the formation of a lot of these local cultural groups, and their activity is to entertain the community while giving them a message. If something is presented to you visually and in an entertaining way, it's much more likely to have an impact on you. So what these groups do is they really entertain. They will have, a song about malaria. They'll have role plays, and often these are quite humorous.
It's very interesting when you see the use of cultural groups and the way through which people are so much interested in cultural performances and the way through which they turn up and attend in all awareness creation meetings.
Another very important area was working to increase the vaccination rate. So we've had a huge success with that, working with the local Department of Health, really supporting them to get to even the most far away, isolated villages. And we've really seen huge improvements in those measures over the years. Infant mortality has thankfully really come down a lot, and that is due to the different activities that the ADP has been carrying out. We've seen a much lower level of malaria. We've also seen an improved access for people to medication. So on the curative side, it is easier for people to get treated, and people are more willing to go and get treated. I think the main goals is to really build on the capacity of the local health workers. I mean, they have proven to be very successful. We would see the future really building on these people and the kind of work that they can do. That is the way to ensure sustainable health care.